What is acute lymphocytic leukemia? An acute lymphocytic leukemia is a type of cancer that blood and bone marrow is affected. The spongy tissue inside the bone where the blood cells are made. The word acute in acute lymphocytic leukemia come from the fact that the disease progresses rapidly and create immature blood cells rather than mature one. The word lymphocytic in acute lymphocytic leukemia refer to the white blood cell called lymphocytes which all affect acute lymphocytic leukemia is also known as acute lymphoblastic leukemia. Acute lymphocytic leukemia is the most common type of cancer in children and treatment result in a good chance for a cure. Acute lymphocytic leukemia can also occur in adult through the chances of cure is greatly reduced. What are the symptoms? Sign and symptom of acute lymphocytic leukemia may include bleeding from gums, bone pain, fever, frequent infection, frequent or severe nosebleed, lumps caused by swollen lymph nodes and around the neck, underarm, abdomen or groins, pale skin, shortness of breath, weakness, fatigue, or general decrease in energy. When to see a doctor? Make an appointment with your doctor or your child doctor if you notice any persistent sign and symptom that concern you. Many signs and symptoms of acute lymphocytic leukemia mimic those of flu. However, flu signs and symptoms eventually improve. If signs and symptoms do not improve as expected, make an appointment with your doctor. What are the causes? Acute lymphocytic leukemia occurs when a bone marrow cell develop error in its DNA. An error tells the cell to continue growing and divided when the healthy cell would normally stop dividing and eventually die. When this happens, blood cell production becomes abnormal and the bone marrow produces immature cells that develop into leukemic white blood cell called lymphoblast. These abnormal cells are unable to function properly and they can build up and crowd out healthy cells. It is not clear what causes the DNA mutation that can lead to acute lymphocytic leukemia, but the doctor have found that most cases of acute lymphocytic leukemia are inherited. What are the risk factors? Factors that may increase the risk of acute lymphocytic leukemia include previous cancer treatment. Children and adults who have had certain type of chemotherapy and radiation therapy or other kind of cancer may have increased risk of developing acute lymphocytic leukemia. Exposure to radiation. People exposed to very high level of radiation, such as survivor of nuclear reactor accident, have have an increased risk of developing acute lymphocytic leukemia. What are the genetic disorders involved? Certain genetic disorders such as Down syndrome are associated with an increased risk of acute lymphocytic leukemia. Having brother or sisters with all. People who have siblings including a twin with acute lymphocytic leukemia have an increased risk of all.